Hi everyone, it's Dr. Karen Leong checking in again with the Face and Body team for another Facebook Live on Monday with me and baby B. So excuse me if I run off every now and then. She's figured out how to be an escape artist and my days of quiet and rest are over. Anyhow, so last week we kind of went over options for breast rejuvenation after baby. I apologize because not only did I publish it on the wrong page, I also was in a room where the connection was pretty bad. So I would be more than happy to go over again what we talked about, which was basically breast augmentation with implants, breast lift with and without implants, and then kind of what the role of fat transfer is these days for people who don't want implants but want some rejuvenation. So if you're interested in that at all, just shoot us a message, and I think we're going to recap that down the road too, but if you want to know something sooner, just let us know. But thank you for joining me today. Sorry, one sec. We've gone topless today. So the topic we wanted to cover today between me and Dr. Park, again, as board-certified plastic surgeons, we like to operate, so we're trying to cover a range of surgery topics. And for me, I'm trying to base it on what a mom might need after having children. So again, in conjunction with, Breast Cancer Awareness Month and Breast Cancer Reconstruction Day, which was last week, we wanted to focus on breast, especially since more than half the population have them, and we all have two. Actually, we all have them. All humans have breasts, but the female population seems to be more concerned with them. So what I wanted to talk about today is, there are a lot of women who went and had implants placed, when they were younger, and then they went through life changes and they're at a point in their life where they decide they don't want implants anymore. Either that or, there's been recent press out there with some of the textured implants that some people use in cosmetic surgery and a lot of us use in breast reconstruction surgery, and a concern with a form of lymphoma, the BI-ALCL, which is associated with the texturing on the implants, and one of the manufacturers did have FDA recall, so there were letters sent out, and I know people were concerned about that. And in addition to that, there's also been kind of a recent surge in cases and interest from patients about breast implant illness, which is, at this point, we don't have a scientific explanation for it, but there are a lot of people out there who've had implants in the past, and they now have concerns about their health, whether it's something immune related, whether it's just feeling overall fatigue, skin changes, hair loss, there's a whole list of things out there. And actually the Aesthetic Plastic Surgery Society recently put out a questionnaire that we are now using in our practice to gauge what your symptoms are and whether or not you might fall into this group of BII patients. We are still collecting data, which is partially why we're using this questionnaire. So we're using it when people come into the office for the consultation, just so we can kind of see what your concerns are and what sort of workup you've had. And then if you do decide to go ahead and explant, which means removing the implant and removing the capsule around the implant, then we do a post-surgical questionnaire to see whether or not you have improvement in your symptoms. So I just need to wash her hand. She stuck her hand in the dog's water bowl, which is her new favorite thing. Okay, so say you had your implants put in for breast augmentation when you were in your 20s. Then you went and had a couple of kids, or you didn't, and time went on, and you just feel like you're done with the implants. We're having more and more patients come in these days who are just tired of having implants, and they're ready to move on to life with breasts without them. But at the same time, they're not really ready to go completely flat. Because most of you remember what it was like having no breasts or very droopy breasts before the implants went in. You're that, or you're very asymmetric, and thinking back, you're like, well, I just don't know. I need something there, but I don't want these implants. What are my options? Now, Dr. Park and I see quite a few of these consultations, and it's part of it is change with society and just kind of what women want for themselves and for their own health. So when we're talking about removing implants, it comes in a couple of different flavors. Obviously, the most basic is to just go into that pocket, take out the implants, and let it be. There is a phenomenon called fluffing, which I'm sure you have seen if you've gone to any of the online forums about breast implant illness or just removing implants. And that is when the skin envelope and the breast tissue almost seems to tighten and fill in the space where the implant used to be. Obviously with much less volume than before, but a lot of people say, it's not as bad as I anticipated, because I thought I would have nothing, and I actually have something, and it's not too bad. I can live with it. So that's the most basic. Just take them out and see what your skin will do. The next option up from there is for people who say, I'm done with the implants, but I also don't want to have to worry about the capsule, because I heard that this may contribute to something that could cause me illness down the road, or it's been associated with this form of lymphoma that I've heard about on the news. Now, if that's the case, then we remove the implant, but we also take out that scar capsule around it. Everyone has a scar capsule around their implant. It's the body's natural response to healing, especially around something that doesn't belong in the body. Now, silicone has been FDA tested, and they say it's non-reactive. It's a non-reactive substance. And I typically tell my patients that you have about as much silicone in your body from wearing lipstick every day as you do from having breast implants in your body. So that being said, I do not discount that there is something to it, because remember, we're putting this in under as sterile conditions as we can, but there is also always room for something to get into the pocket, and over time, what that something becomes, we still don't know. We're studying it. So in these surgeries, we take out the implant, and then we do something called a capsulectomy. You may have heard a term called en-bloc, E-N-B-L-O-C, which means taking out the implant and the capsule in its entirety, en bloc, one big block. So Dr. Park and I tried to do this when our patients request it, but sometimes we have to tell you that it's difficult depending on the quality of the tissue. We always remove the entire capsule, but it may not be unblocked. It may just be a total capsulectomy, which when it comes down to it is exactly the same. These days, we also offer to send it for pathology. Now, the manufacturer that recalled the textured implants says that it will cover the testing, but only if you are symptomatic. That means if you have breast swelling, pain, kind of nerve changes. There's actually a whole list of them. If you're interested in what the symptoms are, just let us know, and we're happy to either post it or send it to you directly. So we remove the implant, we take out the capsule, we may or may not send it for pathology and testing if there's any concern either from your end or ours. And then we decide what to do with the remaining breast tissue. Most of these patients are good candidates for breast lift. So even though you don't have an implant in there anymore, we can reposition your breast tissue so it is back up on the chest, your nipple is put into a more aesthetically pleasing and natural position, and we tighten the envelope. By doing this, you will have smaller breasts, but at least they won't be droopy. And something that Dr. Park and I both do now with these breast revision cases is fat transfer. I am a huge fan of fat. You may ask, well, is it permanent? Will it last? How do you know how much to put in? Will my breasts look lumpy? Will they be able to do mammograms with fat in my breasts? So fat transfer has come a long way since we first started it, and it's become pretty bread and butter for a lot of plastic surgery practices. What we do is just liposuction, and there are many ways to do liposuction, but then we take that fat that's harvested and we process it. Again, there are many different ways to process and purify fat, and that's a good question to ask your surgeon. We then take this processed and purified fat and we replace it into the breast. And we place it into the breast in areas where they need it the most. And usually when we're talking about where breast needs fat, it's either the lower pole, which is the part that fills the cup of the bra because you want more volume, or the upper portion of the breast that we call cleavage. So Dr. Park loves to talk about cleavage, and I feel like I've learned a lot about cleavage from him. In our practice, we have a little card that we talk about, and we show it to you, and we say, hey, what kind of cleavage do you want? And we talk about it the same way when you're looking for your wish pictures. Look for a picture that shows the amount of curvature you like in the upper portion of the breast, so that when you look down at yourself or you're wearing a really lovely dress or a nice top, you have the amount of push-up that you like in that upper portion of the breast. When I do breast fat transfer, I always tell people that if we're doing it for purely volume purposes, it's difficult to get more than 1 cup size up. This is because we have to account for the survival of the fat that we put in, and in order for the fat to survive, it has to have good blood flow. That means that it has to be able to be in contact with other portions of the breast in order to get blood to accommodate the fat so that the body accepts it as part of itself and doesn't reject it and have the body resorb it or swallow it back up. I typically tell people that about 30 to 50% of the fat that we put into a breast will go away. And I know this sounds like a lot, but the good thing about it is that we can do more than 1 round. So, Alexa, off. So again, we can remove the implant and just let it be. We can remove the implant and the capsule either in an en bloc fashion or a total capsulectomy fashion and let it be, or do a breast lift, or we can do all of the above and add fat. So there are different levels depending on your desires. Obviously, we have to do what is reasonable and achievable. So a lot of what happens during the consultation is that we discuss in depth and at length sort of your current concerns and whether or not any of these are actually causing symptomatic systemic issues, and also your goals in terms of rejuvenation. And based on all of those above, we kind of build a plan with you. Now, remember that breasts are sisters and not twins, so we always have to treat them a little bit differently side to side, and our expectations may be a little bit different side to side. But again, that's something that we discuss with you at length. We want you to be happy, and we do our best so that your result is what you hoped for. Anyhow, thank you for checking in with me today. I apologize for baby B. She is really active these days. So she and I are going to run along because she's got her hands in the dog bowl again. But please check in with us again next week for Facebook Live. Let us know if there are topics you're interested in. And I think we're trying a 6 p.m. time next week. And even though we talked about removing implants today, I do want to remind you that if you are interested in having implants, we're still having our breast implant special. And until the end of October, portion of those proceeds will go to support a breast cancer foundation. Okay, bye.